We use what we call aseptic technique, which is where we use sterile instruments and a sterile setup, but we don't have to do this in an operating room. We can do it in a medical office setting. We use our ultrasound to help us decide exactly where we want to get access into the vein. Once we find the best spot, you're going to feel a little cold spray and then a pinch. It feels like a bee sting as I'm injecting numbing medication. And then I'm going to use my needle to find that access point. Once I got into the vein, I'm going to thread a wire through that needle, remove my needle, and then I'm going to make a tiny nick incision. That's the only incision that you get in this procedure. I am now threading my introducer over the wire so that I can remove the wire, and I have an entry point to put the catheter in place. This catheter is connected to a generator that uses radio frequency energy to heat the inside of the vein. Next, we inject some anesthetic fluid around the catheter. The number of injections needed tend to vary depending on which vein we are treating, but most patients describe this as tolerable and generally takes less than a minute of discomfort. And now we're actually ready to ablate the vein. And so the catheter is hooked up to the generator and applies heat up to 120 degrees Celsius. You should not feel anything except for a little pressure and warmth. And then we pull back that catheter in segments until we've completely closed the vein. All in all, it takes usually around 12 minutes or less from the time that I start the procedure to the time when we're finished with the ablation. Once the catheter is removed, we put a Band-Aid over the tiny incision and our last picture after the procedure's done, and we are finished. And that is a radiofrequency ablation.